Did you know that if you've been diagnosed with atrial fibrillation, or AFib, that you're at an increased risk for stroke? AFib affects more than 3 million people in the United States, and the only treatment available is medication. Until now. Baptist Heart Vascular Institute now offers a new procedure that may reduce the risk of strokes for people with atrial fibrillation, called the Watchman Procedure. Here to talk to us more about this new innovative procedure is structural interventional cardiologist Dr. Saurabh Sanon with Baptist Heart and Vascular Institute. Welcome, Dr. Sanon. Thank you for being here today.
Thank you, Brandy.
We'll start with just, why are you in Pensacola? Tell us a little bit about yourself.
Sure. Well, first of all, thank you for having me back on the show. It's great to be back. As you know, I'm an interventional cardiologist, and my specialization is advanced structural interventional cardiology. I trained up in Mayo Clinic in Rochester, Minnesota, and then I was hired to come down here to bring some of the innovative new technology down to this region. Structural heart is a very new field of cardiology, and it deals with repairing heart valves, replacing heart valves, plugging and fixing holes in the heart, and reducing the rate of stroke in patients with atrial fibrillation using devices such as the Watchman device. All of this can be now done through small incisions in the leg instead of opening the chest up. So it's a very new, very exciting field of cardiology. There's a lot of new innovation that's happening in this field right now, and it's a deep passion of mine. It's been a blast being here and helping patients here.
Well, we're happy to have you here. What is atrial fibrillation?
So simply speaking, atrial fibrillation is irregular heart rhythm. It also happens to be one of the most common type of cardiac arrhythmias that we encounter. Simplistically speaking, if you think about it, there are 4 chambers in the heart. There are 2 upper chambers and 2 lower chambers. And in a normal heart, the upper and the lower chambers, they beat in sync. There's a certain rhythm to the beating. In patients who have atrial fibrillation, the upper chambers start going out of sync with the lower chambers. They start quivering. And the result is the patient then develops an irregular heartbeat instead of a rhythmic, steady heartbeat, and that's atrial fibrillation. Now, in and of itself, atrial fibrillation does not kill a patient. But atrial fibrillation will predispose the patient to a risk of strokes. And that is the big problem that comes with atrial fibrillation.
Are there any common symptoms that seniors can look for? What is the age limit? When do you start seeing this?
So atrial fibrillation is considered by many to be part of normal aging, actually. And people say if people live long enough, most patients will develop atrial fibrillation. So it's certainly more common in older patients than in younger patients. Patients generally present to the office with skipped heartbeats, a sensation of missed heartbeats, so irregularity. Some patients will have rapid heart beating or palpitations, and that's a fairly common symptom. And a third subset of patients can sometimes present with just great amount of fatigue and feeling tired and feeling short of breath. And that is their presenting symptom of atrial fibrillation. So any of these 3 things can happen. Now, if somebody has long-standing atrial fibrillation, which is missed and the patient didn't feel it, and that person then develops a stroke, well, then stroke can be a presenting symptom, although that's a rare presenting symptom.
Now, beforehand, you could only treat atrial fibrillation with medication, but now there's a new procedure you're going to tell us about. Can you walk us kind of through what the Watchman procedure is?
Sure. So to answer that question, I'll just share a little bit of information about cardiac anatomy first. There's a chamber in the heart. It's called the left atrial appendage, and it's a little pouch, essentially. And this is the part of the heart where blood clots develop in patients with atrial fibrillation. Now, these blood clots, if they exit this pouch and they enter the bloodstream, that's when it can cause a stroke. To prevent this, as a cardiologist, I often start patients on blood thinners like warfarin or Coumadin or some of the newer blood thinners to prevent this from happening. Another approach to preventing stroke would be to actually block off the opening of that pouch using a device, and that is the Watchman device.
Okay.
So as you will see on the screen, on the picture, the Watchman device is a small umbrella-shaped device, and it's got this mesh covering the top of it. The idea is to insert this device and deploy it at the mouth or the opening of this pouch. Now, all the blood clots remain trapped inside that pouch and they cannot exit. And so the patient is protected against strokes and at the same time does not need to be on blood thinners on a long-term basis. Now, this umbrella is compressed onto a little catheter, and it is inserted from a vein in the leg all the way into the heart.
That is fascinating.
So it's all done in the cath lab, and it's a fairly quick procedure. It takes about 45 minutes to an hour to complete.
What's the recovery time like for this?
Most patients will stay in the hospital for a day or two after the procedure. And once they're home, we keep such patients on blood thinners for another 6 weeks. And at that point, after certain checks have been made, patients can come off of blood thinners. So the hospital stay is only 1 or 2 days. It's a short hospital stay.
Wow. Are there any kind of thing they need to talk to with their primary physician if they're interested in this kind of procedure?
So first of all, the Watchman device is currently the only FDA-approved device to prevent strokes in patients with AFib or atrial fibrillation who cannot tolerate blood thinners or who are at risk of bleeding with blood thinners. So it's the only device out there right now. The patients that qualify for this procedure are patients who first have AFib, second, they are at risk of stroke, and third, they have either had bleeding with blood thinners in the past, or they are at high risk of bleeding with blood thinners. So this is the patient population that benefits the most from this and qualifies for this procedure. So I would say if you have atrial fibrillation, if you've had any of these problems with bleeding, you should talk about this procedure to your primary physician, and he can then refer you to a Watchman Center or to us.
Is there an age requirement for it? I know there are a lot of procedures out there. They prefer you to be, over 60. Is there anything like that?
This is one of those slightly unusual indications where you see more younger patients. Because if you think about it, the lifetime risk of bleeding while on blood thinners is much higher for a younger person on blood thinners than in an older patient. So really there's no age cutoff. It could be any age, any patient who has AFib, has a risk of stroke, has a risk of bleeding, and wants to come off of blood thinners.
And if any of our viewers want to get more information today, what's the best way to contact you?
They can go to the website that's listed on the screen, or they can call the office number listed and ask for an appointment with me.
Wonderful. Thank you so much, Dr. Sanon, for being here today.
Thank you, Brandy. Pleasure.